Hi guys, welcome to the Corona Show. I'm Dr. Jordan Axe.
Dr. Benner, good to see you guys.
And we want to talk about genetic factors, right? Genetics are a big deal and they create a big impact, and specifically on our immune systems and our energy levels. And so there's two different genetic factors we want to talk about that people are most susceptible to.
Well, the ones that we hear about more is COMT and MTHFR. These are methylation SNPs. But long and short of it, folks, we're all made a little bit differently. But if you go and get a 23andMe test or an ancestry test, that is a good way of finding these SNPs. Now, why are they so important? Well, there are certain things these are two things that Dr. Axe and many other SNPs will look at as well. But these are two SNPs that we'll look at every time we see a functional medicine patient. The reason why is because if you have methylation issues, there's two main things that it actually causes little deficiencies in your body. Okay, you do not detoxify as well as a person that methylates properly, and you also cannot build or maintain your nervous system and energy as well as a person that methylates properly.
Wow, that's a big deal.
Yeah, and so the good thing is this. When we identify that, there's certain things that we can do.
Yeah.
Okay, so the main thing is a person that doesn't methylate well, just like anybody else, but especially the person that doesn't methylate well, they have to watch their stress, right?
Absolutely.
Big surprise.
Yeah.
All right. But the other ones is that instead of taking a multivitamin that has B12 or what's called folic acid in there, that's a good.
Yeah.
If you have a vitamin that just has B12 and folic acid, throw that thing away. Usually it's useless.
Yeah.
But the other one that we'll utilize is we'll get B12 that is methylated and methylfolate, which is actually made in nature and not from coal tar.
Yeah.
And the great thing about that is if you don't methylate properly, we can do this little simple lifestyle modification, add that on, and allow you to have the methyl donors to allow your body to function properly.
So if you know that you have that genetic problem, you can simply take a different kind of B vitamin, essentially, right?
Yep.
Like a methylated B complex, I like Designs for Health has a liposomal, which means it's fat soluble instead of water soluble. You put it right under your tongue, it's pre-methylated, you absorb it. And that's huge because if genetically you're not able to absorb those B vitamins, again, it can cause anemia too, issues with iron, and the big thing is energy production. Every cell of your body has a little energy factory, and it needs B vitamins to turn glucose and sugar and foods that you eat and turn that into energy, right? So if your cell can't make energy, you're gonna be tired, you're gonna be gaining weight, you're gonna have anxiety, depression, some of those big things. And a lot of them are linked to these genetic mutations. And sometimes it can be an easy fix if you know it.
It can be an easy fix, but you know what the problem is? There's a lot of people that are doing all the right things, and that is one thing that their functional medicine doctor or medical doctor is missing. And if you don't detoxify properly, if your liver is not working properly, and if you have hormonal imbalance like a female, and your liver is not able to help regulate those hormones, that's a big deal. You know, and energy. So sometimes you can have all those factors in the row and doing the right thing, but if you miss that one thing, because it's usually cumulative, right?
Absolutely.
You know, so
the devil's in the details.
Devil's in the details. So it'd be good to get that 23andMe and ancestry test.
Yeah.
And then if you ever want to look into it a little bit deeper, because that's just one component of healing.
Yeah.
What you could do is you could set up a consult with Dr. Axe and I, and we can help you put those things together.
Awesome. Is there any other? I know we talked about MTHFR.
Yep.
Any other?
COMT. That's another methylation issue, but that is, there's many factors involved in COMT, but that also can be tied into depression.
Yeah.
So if you have depression and you're under a lot of stress, that stress is magnified because your outlook on life is just going through a different lens.
Yeah.
But if you can imagine, if you can have somebody that will be able to detect and determine if you have COMT, and we can do a simple nutritional modification protocol, that can make all the difference in the world.
Yeah, so genetics are extremely powerful, not just for energy and mood, but for a proper functioning immune system. So we can be be on the offense and fighting disease and living, a joyful, energetic life that we were designed for. Yeah, that's what we deserve. Awesome. Thanks for joining us, guys.
Have a good day.